Barack Obama is they expanded Medicaid to young, healthy adults. And so what the House has done, which I've been advocating for a long time, is if you're a young, healthy adult, you should be working and you shouldn't be getting Medicaid and sitting at home just getting a government check.
Now, I'm a Medicaid provider, so let's say we have a patient. Let's call her Mary. And Mary lives in a rural part of the country, and she works at her local grocery store as a checkout clerk. It's a minimum wage job. It offers no benefits, but she gets her health care through Medicaid. Now, times are hard, and her grocery store got hit particularly hard by tariffs and supply chain issues, so they have to lay Mary off. Now, Mary is scrambling to find a job so that she can stay eligible for Medicaid. But unfortunately, a lot of people in her small town got hit by these layoffs, and there really isn't much work to be had. And the nearest town with work is about a 35-minute drive away, but unfortunately, Mary doesn't have a car, and the public transportation system in her town is particularly dismal. So she keeps trying to find work, but unfortunately during this time she loses access to Medicaid, which means she loses access to her primary care doctor, her specialist, and the ability to get medications. And without those things, Mary's health starts to deteriorate, and she's in and out of her local emergency room with flare-ups of her diseases. And now she's racking up tons of medical debt. As Mary's health continues to decline, she realizes that she can't really stand for prolonged periods of time because of her rheumatoid arthritis, and she realizes that being a checkout clerk is no longer going to work, so she looks for other jobs, more sedentary jobs like a receptionist, but unfortunately a lot of those jobs require prior experience, which Mary doesn't have, so she doesn't get hired for those. She tries to apply for disability and then volunteer and do some community service so she can get access to Medicaid and her health care again. But unfortunately, the process to do this is very bureaucratic. There's tons of red tape, it's confusing, and a lot of it requires access to either a smartphone or the internet, both of which Mary lost access to because when her services got cut off, she couldn't pay the bills. She had to choose between her utilities and food, and Mary chose food. All of this is extraordinarily stressful for Mary, and she's still trying to find work, but she's getting sicker and sicker. And one morning she wakes up and she's really nauseous. She's vomiting. She's got a headache. She's dizzy. She's got chest pain. She's short of breath. She's a little confused. So she calls 911, and the ambulance comes to pick her up to take her to the emergency room. Unfortunately, her local emergency room has closed because it was primarily getting its funding through Medicaid, and with all these Medicaid cuts, they had to shut their doors. So the ambulance is forced to take Mary to an even further emergency room outside of town. But unfortunately, by the time she gets there, she has slipped into a coma. When she gets there, they test her. They find out she has diabetic ketoacidosis from missing her insulin, not by choice. She couldn't afford it. And she winds up in the ICU for a few days, and unfortunately, Mary dies. So let's pause there and have this discussion. So do you guys think that Mary was a freeloader? Do you think that she was just someone who was sitting at home getting a government check, milking the system? Or was she a victim of that system? Was she stuck in this vicious, perpetual feedback loop from which she couldn't escape? Were there many systemic and structural issues that were impacting Mary's ability to get care, Mary's ability to get work? Don't let MAGA Republicans gaslight you into thinking that these are just work requirements. They're not Medicaid cuts. They are most certainly Medicaid cuts. We have data to support this. They did this in Arkansas, and when that happened in Arkansas, what happened was 18,000 people lost access to their health care, and it had no impact in employment. What this is going to do is it's going to make millions of people lose their health care. This will make the chronic disease epidemic worse, not better. People are going to get sicker. People are going to die. Rural healthcare systems are going to collapse. That is going to further exacerbate the already existing healthcare disparities, which contribute a lot to our chronic disease epidemic in this country. It's not good. As a physician who accepts Medicaid patients, I'm telling you right now, this is not good. But what can you expect from the pro-life, Make America Healthy Again party? Am I right?